if you have good, strong family, if you have strong family background, good financial circumstances, and you can dedicate all your time to your career and your books. Uh, you have to go to US to do electives as well. So if you can fulfill all these criteria, then you can do USMLE after the MBBS as well. Uh, Another question was trainee and non-trainee jobs. Can you clarify which country you're talking about, Sadia?
Sir, the participant was asking about non-training jobs in Ireland after house job.
Yes, there are non-trainee jobs. Your portfolio should be strong, which means that you should have research, you should have attended some resuscitation course, you should do an audit or QIP. So if your portfolio is good, do apply for the jobs. There are jobs, they are competitive, but people are getting these. You should just outshine them. It's not only the exam, but also your portfolio that matters, because at the same time, people are applying for these jobs from all over the world, and you have to outshine them with your portfolio. So you complete the basic requirement, but on top of this, you have to do some icing on the cake to get yourself selected for these jobs.
So how can we make our portfolio strong?
So as I mentioned just few seconds back, by writing a research paper, uh, by doing an audit, these are very easy things to do. By doing demonstrating leadership, like even a certificate of a vaccine, of a hand washing program, which you organized, and that can be useful. Uh, by attending the virtual courses, which are free online courses, these all show that your dedication towards that field. uh, and if you have done as a student, medical student, if you have done anything for the benefit of the public, so if you have joined any NGO like this NGO which is working, if you are part of that, so these all are put stars on your CV, which are appreciated by the people abroad.
Sir, there are also a lot of questions about Gulf countries, how they can join Gulf countries after their FCPS or while doing FCPS or after house job.
So after FCPS, yes, there are a lot of opportunities. Very easy. There is an overseas overseas corporation, OEC or something like this, overseas Pakistan corporation. You can go to their website and you can find the list of the jobs that are coming regularly there. Also, there is another recruiting agency, Al Najm Internationals. So you can send your CV to them, and then they can tell you the opportunities. On the Facebook, I have one group with the name of Doctors Jobs and Residency Updates. I know a few guys regularly post the jobs from Gulf there, so you can apply for these jobs. And this is after the FCPS. In some countries like Dubai, you have to give DHA exam, but the job situation there is not good. There are other countries as well where you can go after FCPS and they ask you to do their exams after joining within 1 year. These exams are really easy. So Gulf is still open for Pakistani doctors, especially after the FCPS. I don't recommend to go to Gulf before FCPS because there are not a lot of job opportunities, but yes, a lot of after FCPS.
So can you please give us some guideline about AMC?
About AMC, because actually I have written this book, and one of the guy who is working in the Australia has written the guidance of that. I'm not the best person because I have not worked in Australia to talk to you about AMC. So you can, and after also on my Facebook page, My Medical Career, that page I posted very recently, few weeks back, about AMC 1 and 2. So you can read about that. There's a Facebook group as well, Pakistani Doctors in Australia. A lot of information is there. Go there. One thing I would like to encourage all of you: try to follow the information that is provided by a person who has himself uh, did that exam or has worked in that country, rather than just blogging for you guys. So in this book, My Medical Career, what we have done is that USMLE pathway is written by someone who is in the US doing residency. AMC is written by someone who is working in Australia. Irish pathway is written by Dr. Labik, who is working in Ireland at the moment. And rest of the countries I have worked myself. So just follow the advice in the book, what I can say.
Okay, sir. Sir, sorry, sir, is there any other pathway to go to US if we do our FCPS in Pakistan except USMLE?
I know you have to do USMLE. This is the licensing exam. You have to pass USMLE to touch the patient in the US. That is must.
Okay, sir. Sir, can you please tell us about the year gaps that we can take in the steps of USMLE, step one and two? How many year gaps can we?
I believe year gaps are not very much important, but you should try to clear within 5 years of your MBBS, because I've learned that few now programs, they don't shortlist the candidates who have already passed 5 years of their graduation. But year gap no should not be more than 1 or 2 years, and that should be explainable. Mahira is
Okay, sir.
asking, do you have a YouTube channel? Actually, I'm a full time working on colleges in the UK with a lot of clinical commitments. I don't have a YouTube channel, but I found I just wrote this book, which I believe can help all of you.
Uh,
Sadia, over to you.
Sir, there is also a question can someone go to Gulf countries after giving their step 2 without giving their step 1?
Step 2 of USMLE.
Yes, sir.
Uh, I'm not sure. I don't think so. There are criteria mentioned on their websites, which you can. Uh, After giving both step 1 and step 2, definitely you can go to some Gulf countries, but I'm not sure that you can give only after, because you have to be ECFMG certified. So which certification you get only after you do the step 2 as well.
सर ये FRCS का पाथवे बता दें सर.
FRCS pathway. So what is happening here is that FRCS is different for FRCS, ortho, FRCS of all the specialties.
सर न्यू सर जी वाला.
So you have
आपने माइक आप करें बराई
so you
करा
do
प्लीज.
MRCS first. So Altaf, you do MRCS first, and then it changed into FRCS after fulfilling the some criteria. But what you would be doing is the preferred is do MRCS, and because FRCS International will be like my urologist friend, he has done FRCS International. My another orthopedic, he has done FRCS in International Orthopedic. So for general surgery, you will do MRCS, which after certain years and fulfilling the criteria will be changed into FRCS. The same is true for MRCP. There is no any FRCP. You do MRCP, which is their license exam. You start working in the UK on the basis of MRCP. And after that, if you want to go for fellowship, you fulfill their criteria of London College or Glasgow
ये
College,
सर
and then
जब आप
you.
एडवांटेज क्या होगा?
The most important thing is that you should do the licensing exam first to get GMC registration. So do that qualification, so FRCS will get you GMC registration. Now if you have done FCPS, in your CV you will be demonstrating confidently that you have gone through a structured training program in Pakistan, which definitely they would love to hire a person who has undergone a structured training rather than a guy who has not gone through a training program. So that really helped you. That was my experience. I used to tell in every interview that I have been through a very structured program by College of Physician Surgeons Pakistan. So that definitely helped.
Sir, I have a question.
Thank you sir.
Yeah.
Sir, as you told that there should not be any gap between your in your during your career, and I have a gap of 4 months in between my result of final year and the start of my house job.
No worries
So will it affect?
at all. No worries at all. The fund gap, as long as it is explainable. We should very honestly tell them that what was the reason. Even if you was preparing for an exam, you can honestly tell that you was preparing for the exam, or if there was medical illness. So any gap that is understandable, which doesn't show that you just left the career and joined it back, uh, that is very much fine. Yes, if there is a gap of 1 or 2 years, that can put you in trouble. So 4-month gap will not cause any problem.
Thank you.
Especially at the time of the job application, you should be in clinical practice.
I have a question also.
Yep, Usman.
Yes, sir. Can you please tell me about the significance of MRCS Part A from Pakistan and then applying for job for Ireland and then doing Part B from Ireland, then moving to UK for surgical training, higher surgical training?
Yeah, so MRCS doing from any country of the world or any region of the world, it has the same value. So even if you have done MRCS one in Pakistan and you appear in MRCS be in the Ireland, that will have the same value if someone has done the MRCS in whole MRCS in Ireland or in the UK. On your result, it will not be mentioned anywhere that from which region of the world you appeared in any exam. So it is a good strategy, I believe.
No, sir, I have a question. Sir, can you please tell me about that MRCS Part A from Pakistan and then applying for job in Ireland will be significant benefit for us or not?
So on what basis you are applying the job? If you get IMC registration on the basis of the house job, then
Yes,
MRCS will definitely add value in your CV because it is an extra qualification. It demonstrates that you are studying, you studied recently for an exam, you've cleared that exam. So that definitely will help you. So if there are two CVs, one person has done MRCS, one person has not done MRCS, naturally they will pick the person who has done an additional exam, which demonstrate that he's more knowledgeable.
only one part.
Only one part. It just demonstrates that you are studying recently and you have appeared in an exam recently.
Sir, can you please tell me about IMC registration house job process? That I have rotation of urology 2 months and orthopedic 1 month.
Usman,
Is it acceptable or not?
Dear Usman,
Sir,
you can read through the book. It is written there.
Sir,
Thank you.
I have one question, sir. Can you please, last question, sir, please. Please, sir, please.
Yeah,
Sir,
please.
can you please tell me about that I have rotation of urology 2 months and orthopedic surgery 1 month. Is it acceptable or not? Many people saying it's acceptable and many people saying it's not acceptable.
Have you done general surgery?
Yes, sir, for 3 months general medicine, 3 months.
It is acceptable. 3 months general surgery, 2 months and 1 month urology, that makes it allied 3 months and 3 months general surgery. It is definitely acceptable.
Thank you so much, sir.
Welcome.
God bless.
अस्सलाम वालेकुम सर।
Yes. वालेकुम अस्सलाम।
सर ये लोग कहते हैं कि प्लान ए बाहर मुल्क के जाने के लिए USMLE है, प्लान बी जो है वो प्लेब है और प्लान सी वो कश्ती है। तो सर इसके बारे में जरा बताएं।
Kashti is the best, because after you will just get tension free, because after even going to the US you would have to work hardest. So anyways, that is not true. Even if you stay in Pakistan and if you work hardest there in Pakistan, you can make a very good career there. I know the consultants who are earning 4 to 5 million per month in Pakistan. After the FCPs, my first job in Pakistan, I was offered a salary of more than 2 lakh. So it's not that dark in Pakistan as well.
Hello.
Yeah.
Sir, after getting house job, SHO job in Ireland, how long after we can apply for MRCP exam and the training there in Ireland? Can you please tell?
Can apply straight away for the MRCP exams. There is no any experience criteria for MRCP1. Only for patients that need an experience of 18 years of medical experience, which include 12 months of your house job experience. So you
Sir,
can
difference between MRCP UK and MRCP Ireland?
At the moment, both have the same value because recently GMC has acknowledged MRCP Ireland as a acceptable postgraduate qualification, which means that whatever you do, it has same value. Also, after the MRCP Ireland, you can apply for ST training in the UK, which means that now there is no any difference between these two.
And what is the passing ratio of both?
I believe MRCP Ireland is easier to pass. So last question, Naeem or Sadia.
Hello.
Hello.
Can you hear me, sir?
Yep.
Yeah, sir, I have some questions from you. Actually, मैं बहुत confused थी अभी. Sir, actually, I did MBBS in 2019 and then FCPS in 2020. Then I did 1 year residency from Indian Hospital as well. In 2022, I got married and then I shifted to England. So since then I'm living here. So sir, I have just experience of my house job I have and 1 year residency. So now I want to get enrolled with the GMC. So I'm confused. What should I do now? Either I should go for MCPS or PLAB for GMC registration. I recently cleared my OET exam as well. So can you guide me? What should I do?
I would suggest to go for MRCP. The reason is that there is a job situation for the PLAB. There are thousands of applicants already who have done PLAB and applying for the jobs. After the PLAB, it is difficult sometimes to get a job, especially if you have graduated 4 or 5 years. By the time you will clear the PLAB, it will be already be 5 years that you would have done your graduation. So MRCP is a better choice because it is a bit high level exam and they would love to take you as a med reg without even if you are not in very much clinical practice at that point.
So I have one more question. So since actually I'm free right now, so I'm doing nothing. So what should I do here to improve my CV?
You should do the clinical attachments as much as you can so that you can get good reference from the UK consultants. They will help you in getting your first job.
How I can apply because it's very difficult to get.
I have applied. I have proposed to my hospital. Let us start the clinical attachments in my hospital. So if you go to the websites, you will find that many hospitals are actually offering these clinical attachments. Fill their forms and wait for your luck.
So any
Last
requirement
question,
for
Sadia.
attachment?
Please, Sadia, ask the relevant questions.
Yeah, apologies, Sadia. If you can ask the last question because there is another meeting I have to
Ji, sir.
attend that is of the Oncology Society.
Ji, sir, my last question.
Assalamualaikum, sir.
Yes, Naeem.
Please, Sadia, don't ask illegal questions.
Excuse me, please. Be professional.
Sir, can you tell about the research programs, how to do it?
Naeem, I'm waiting for your
Excuse
question,
me.
please.
Excuse me, please.
Naeem, please ask us your question.
Sir, my question is, many people are facing the problem of matching after clearing PLAB step 1 and step 2. What is the probable solution for this?
The references, they should try to make connections. They are they are different called medical colleges, associations, alumni who are in the US. So the connections and references help a lot, and they especially in the US. So what they should do is that in the Twitter, we commonly see this trend hashtag #MedTwitter. I'm US. I have scored this one. I have achieved this one. I'm waiting for a residency. If someone can help, and you will find that your post will go into the feeds of many people who are working in the US and are from Pakistani heritage. Likely you will be able to connect one of them. So it's the connections in the US. You can Google, you can go to social media, choose everything to find, or you find any your class fellows, request them, and these references can help you get your match in the US.
Sir, we don't get
the first job.
Sir, we don't get experience certificate from private jobs here. So how can we, for UK and Ireland, how can we add that in CV?
I will answer only to the question of Naeem Khan and Sadia as I suggested before. So
I muted all the participants. Sadia, if you have a question, ask from sir. That will be the last question. Dr. Sadia, can you hear me? एक मिनट just a minute, yeah, please. uh, sorry sir.
That's very much fine.
Sorry sir, sorry. Sadia.
I believe, Naeem, we can conclude the session here. Excellent brainstorming session today. Good work by you, Naeem and Sadia.
Thank you
I'm
sir,
really
thank
proud
you.
of you that at this stage career, you guys have organized this meeting, because this is the time when most of the doctors are just, medical students are just enjoying and have spending attention free sort of life. It's excellent for you guys. And I would love to do any further sessions if they can help our medical students. So thank you everyone for joining the session. What I demand from you, just remember me in your prayers. Allah Hafiz.
Thank you sir, thank you. Thanks for giving the most and very precious time to us. You guys can leave now. Thanks for all. Thanks to all for participating. और मेरा बिल्कुल सर दर्द कर रहा है. ओहो, सर में दर्द के कसम ده اوفو هذا كسانو ده غومنا ما يكون يا ان بريفو ده سرنج بروفيشنال فون. What a nonsense. कम साइड में यार से याव سخونه دي कम سيزونه कंट्रोल کول. just a minute यार د التاب 1 منټ زه تاسو ټول الاو کوم. تاسو بیا خبرې کولای شئ. صحیح ده.
Can you people kindly arrange some Zoom meetings about TMC?
Mariam, hello. Mariam, मुझे अनब्लॉक करो.
नहीं भाई साहब सुधा
सबसे पहले आप participant
हाँ be professional guys please. हमने इतनी मेहनत की without any self benefit, फिर भी आप लोगों को thank you बोल रहे. सही है. अभी लास्ट में
मेरा क्वेश्चन
नहीं भाई डीपी दे रहा मजेदार है नहीं भाई.
हाँ सही है.
when should we get married before
नहीं
PLAB
भाई
or
इमरान
after?
इधर बाहर.
बस अरसा ही करना अरसा ही. अरसा ही यार ना बस रहो. ओ सॉरी यार.